Right Brain versus Left Brain, an excerpt from Sam Keene's The Tale of the Dueling Neurosurgeons. W.J. was an American officer during World War II who suffered brain damage first when his parachute failed to fully open, and second when he was hit on the head with a rifle butt as a prisoner of war. Symptoms following the first incident included unconsciousness and blood in his urine. After the second incident, he was believed to have suffered from a brain hemorrhage. No treatment was given following either incidents. After the war, W.J. experienced major symptoms that would interfere with his daily functioning. These included memory issues, seizures, and trouble focusing. Seeing no other options, he agreed to an operation that would be performed by two LA surgeons, who proposed cutting through his corpus callosum. He appeared to function normally after, with no side effects, but some thought that there had to be some type of impairment done by the severing of his corpus callosum. Through use of a tachioscope, Roger Sperry and students would later perform a critical experiment revealing new knowledge regarding the function of the corpus callosum. An ethical concern to take into consideration is that the procedure was experimental and no positive results were guaranteed, only hypothesized. But the surgeons did have the consent of W.J. before performing the surgery, which was said in the reading to be done out of desperation for finding a cure to his symptoms. The corpus callosum can be seen on this illustration highlighted in green. It is composed of over 200 million white matter fibers which vary in composition. Fibers range from thin and unmyelinated to thicker and heavily myelinated. The wide assortment of fiber types allows for a great deal of flexibility considering the function of the corpus callosum. Prior to the more prevalent use of chalcectomy, the one known role of the corpus callosum was its notorious function of spreading seizures throughout the whole brain. After experimentation on those who had undergone surgery, it was found that this structure also serves as the major communication pathway between the two hemispheres of the brain, transferring both sensory and motor commands between the two halves.
To minimize the seizures that JW was experiencing, two LA surgeons proposed that they slice through the corpus callosum. This technique was suggested because X-rays showed people born without the corpus callosum, and they seemed to lead normal, healthy lives. By monitoring the electrical pattern of the seizures, neuroscientists knew that the epileptic storm seemed to get stronger when crossing the corpus callosum into the other hemisphere. The procedure took 10 hours to carefully slice through the connection between the hemispheres. The corpus callosum is located deep in the brain near many delicate structures that had to be avoided during surgery. After the procedure, it took a month for JW to start talking again, and then 3 months for him to start walking. His seizures stopped completely, and his memory, fine motor skills, and personality were still intact. This seemed to be a complete success for the LA surgeons, so they started performing more chalcectomies on seizure patients. In the beginning, it was hypothesized to have no negative effects on the patients. The LA surgeons enlisted Roger Sperry to perform tests on their patients to see if the surgery had less apparent side effects than just minimizing seizures. They chose Sperry because he had made a name for himself, testing other scientists' theses and disproving their work through experimentation. Sperry and his students first tested on JW using a datacoscope to flash short bursts of an image to the far left or right of a screen so that it would only register with one side of the brain. JW was instructed to press a button when he saw an image. The image on the screen was relayed to his left brain that houses the language center. So he pressed the button with his right hand and could tell the scientists what he saw. When the image flashed to the left, they were picked up to the right side of the brain that does not have a language center. So he'd say he didn't see anything, but his left hand would press the button saying he did. This experiment replaced the idea that the chalcectomy had no side effects and showed a disconnection between the left and right hemispheres. This and other experiments highlighted the differences in the right and left hemispheres and the way they process information. The previous school of thought was that the left hemisphere was superior in every meaningful skill. It wasn't until experiments were ran on split brain individuals, those who had had chalcectomies, that the importance of the right brain was discovered. It is better at facial recognition and thinking outside the box. Being able to test on chalcectomy patients helped discover and understand the individual characteristics of each hemisphere and what happens when they are unable to communicate. Chalcectomies are still performed for the most severe forms of epilepsy and seizures that are uncontrolled by anti-seizure medication. The bravery of J.W. to allow experimental surgery on his brain was instrumental in understanding the brain's hemispheres and to provide an option for future seizure patients.